So now we're going to go from beginning to end of a patient that comes in with knee pain. We're going to, in this case, start with the functional assessment and then go into the orthopedic assessment and then go from there. So when a patient comes in, we've already pre-screened them. There's no red flags. There's no reason to send them to an orthopedic. We're going to go straight into the assessment and the treatment. So first thing we want to do is check the transverse abdominis and obliques when it comes to a lower body issue. I'm going to push this way. Slightly bend your knees. Good. I'm going to push this way, you push that way. Very good. I'm going to push that way, you push this way. Very good. Transverse abdominis, obliques, they're pretty good. You can lay on your back here. So we're going to just imagine that the discomfort is on this leg. So we're going to start on the other side. And we're going to start with our functional assessment. So keep it here. I'm going to push down. I want you to push up. Push. Good. I'm just moving away so the camera can see. I'm going to push down, and I want you to push up. Keep your leg straight. Very nice, nice and strong. I'm going to push in now, and I want you to push out. Glute medius. Relax. I'm going to push in, and I want you to push out again. TFL. I'm going to push out now. You push in, okay? Very good. Okay. Before I have them turn over, I'm going to go right in here. And keep it here for me. I'm going to push this way, you push up. Very good. Relax. I'm going to push down, you push up. Very good. I'm going to push in, you push out, okay? Push. And there's some weakness there. One more time, push. And weakness there. TFL and glute medius on this side. I'm going to push out now, you push in. Very good. Let me have you lay on this side for a second. We're going to check the glute minimus now. Don't let me push you down. That's pretty good. Let me have you lay on this side. So we're going to straighten out the leg. Don't let me push you down. Good. Can you go onto your stomach? And what we're going to do now, just lift this thigh up. Don't let me push you down. Glute max is pretty good on this side. Normally I would go around, but just for the camera. That's very good. Okay, good. You can lay on your left side. So, actually, on your back, sorry. So now we know functionally that the glute medius and the TFL were not firing appropriately, and we want to see what tissues are actually involved here, what are causing pain. So we're going to do, we have a suspicion that it's lateral tracking of the patella, so we're going to do a compression test, and if that's positive, it's going to tell us that it's chondromalacia. And of course, through the combination of the history. So we'll pursue with the treatment. I'll have you lay on your left side now. So you can kind of see how once you get used to the assessment and you can streamline everything very quickly. So can you roll this down a little bit for me? Great. So glute medius and TFL were inhibited. So we're going to go from the sacral hiatus, 1, 2, 3, 4, 5. And then we're going to go to the TFL, greater trochanter, ASIS. We're going to half it. And we're going to stim these. Definitely feel it under my fingers. It's hard to see through the camera. You okay? Mm-hmm. We're kind of doing this a little quick, but I would have Cho in a much comfortable position, bolster her hips. And now we're going to do the TFL. We're going to push down a little bit. You okay? Yeah. So we want to start low. We got the twitch there. And we'll take these out. Good, you can bring that up. Now, we could also do some gua sha on the hip after we do the correction there. You can lay on your back now. And now I'm going to try to see if it's any change in the glute medius and TFL. I'm going to push in, I want you to push out, okay? Push, push, push. And very, very clear that that's much stronger. I'm going to push in, you push out. Push, 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 yeah. Very good. Okay, so now we're going to go into the treatment of the knee. Since we fixed the dysfunction, I'm going to put this right under here. Very nice. So we're going to do that vastus medialis point. We're going to do stomach 32-ish. And of course you could palpate. Yeah, we got a little twitch there. We could do spleen 9. Stomach 36, great point for knee issues. And of course, Xiyang. So again, we're going to find that lower part of the patella, move medially, and then we're going to angle it towards that superior lateral portion of the patella. Nice and slow. A 1.5 centimeter needle can go all the way in without hitting anything. If we do, we might have to just reinsert it. Nice and slow. Good. And now I'm just going to take this sock out. So I like using distal points. So in this case, you can use liver, you can use kidney if you wish. Since the large intestine 4 and liver 3 are a great pair, I'm going to connect those. Once these are in, I can do my auricular acupuncture. We can do Shen Men, ear knee. In this case, I'll do ear knee, whatever is more tender. And we can connect ion pumping cords. And for sure, we want to connect the electric stim. Just like we did earlier. And again, this is real time. Once we set the needles in, if it's appropriate, I will put a heat lamp over the patient, over the knee. And we would get these going. Another thing you could do is once you put the heat lamp, you can definitely put a liniment that you would like to incorporate into your treatment. Just dab it on some alcohol or put it in a spraying bottle, spray some of that liniment, and then you could put a heat lamp if you wish, and you let them rest for about 12 to 15 minutes. That's it from beginning to end.